So, I've written, Moby Health News has written about Buoy a few times, and one of the distinctions that I found to be really interesting is, people see it maybe who aren't familiar with the industry. They say, oh, asking questions to get a diagnosis. It's just like WebMD. That's been around since the 90s.
Sure.
But there's a big difference between that kind of decision tree thing and what you do. Can you spin that out a little bit?
Yeah, sure. So the traditional kind of symptom checker 1.0, to your point, was very decision tree based. So if you had a fever, you turn left. If you had a cough, you turn right. And one wrong answer can really send you down a particular path. And as you know, medicine is it's not just a one-way path. So the way Buoy works is really trying to have a conversational, adapting, evolving conversation just the same way a physician would. So you might say no to a fever, but we're still convinced you have the flu. So later on in the conversation, we might say, do you have the chills? And you might say yes to that. So we're really trying to continue to drill down into what's the right question to increase the probability of a diagnosis and not necessarily worry about every single answer you've asked until we feel confident that we have the right diagnosis.
So I'm sure that a lot of success for you is going to depend on having not only efficacy, but efficacy data, right? And being able to prove that you're offering good recommendations or diagnoses.
Yep.
How's that process looking for you now?
Yeah, so it's a great question, and I think to date it's all been very consumer-driven. So everybody who goes through Buoy has an opportunity to give feedback at the end. As you know, that's all self-reported. We've run various experiments where we've put Buoy on an iPad, put it in a urgent care center, and compared our diagnosis with a physician's diagnosis. But we always joke, who knows if the physician's diagnosis was correct too? So it's constantly an evolution. The more we work with health plans and employers, the hope is that we can start to link this to claims data over time and figure out, did the Buoy diagnosis within 72 hours of the illness align with the actual claim that we saw 3 weeks later or a month later?
Right. Yeah, I think it's tricky, right? Because Babylon in the UK, they kind of tried to do this whole publicity stunt where they made their software take the GP test in England, and it kind of backfired on them, right?
Yep. Yeah, so the other piece too is really setting expectations. So we don't want any user, whether it's a consumer, an employee, a health plan member, to have the expectation that they're coming into Buoy to get the exact answer. We want to provide some level of context. Every diagnosed match that we provide all the reasons why we think it's right, reasons why it might not be right, and just the level of detail that we're providing information, but we're not declaring 100% we know exactly what your condition is.
Yeah. How does this whole modality fit into sort of value-based care and the ways that healthcare is changing?
Yeah, so it's a good question. I think over time we'll probably start to migrate more to health systems, ACOs as potential clients. We've been focused on the employer market and the health plan market to date, but you can imagine, so much of everyday care is inappropriate or overutilization. And so as more and more folks take on that risk, if they have an opportunity to provide any kind of virtual tool to keep people out of the emergency room or out of their high-cost centers at a much lower cost at scale, I think there's a huge opportunity.
And you do have a partnership with Boston Children's, right?
We do, yep. Yeah, it's a learning partnership. So Buoy Health basically covers over 2,500 diagnoses. And we saw an opportunity with Boston Children's to really make sure that our pediatric cases were as good as we could get, and who better to partner with than Boston Children's to help us with that.
Great. What about voice technology? I know that's an area of interest to you.
Yeah, it is. Yeah, so multiple players have asked us to potentially put the Buoy algorithms on Alexa or Google Home. I think we'll get there at some point. To be totally honest, our team is just too small to focus on voice at this point. But I think as we, expand to different populations, and if we get into the Medicare population, various consumer preferences, I think we'll probably get to voice at some point in the next 3 years.
Yeah, I think we have time for one more quick question. So,
Sure.
Biggest lesson learned so far?
Needing to say no. There's so many opportunities to apply our technology. And as an early stage startup, it's really exciting to say, we want to try this use case, and that use case. And really trying to stay focused on making sure we do a couple things really well. And we've seen a lot of success in the early stages of 2019 to date.
Great. Thanks so much, Jason.
Thank you.